Hi, I'm Dr. Kevin Davison at Maui Regenerative Medicine. We're in Haiku, Maui, have been in operation for 17 years, doing regenerative medicine techniques that involve essentially the restoration of collagen-based injuries, which essentially means joints, tendons, ligaments, any place where there's connective tissue damage. So what we're offering is an option, or I should say a viable alternative to surgical intervention. Most people don't really like the idea of surgery, and when they have an injury of their shoulder or their knee or any other joint, they're thinking that they may need surgery because that's what the go-to seems to be. What most people don't know is that the normal model for medical treatment in orthopedic medicine involves a degenerative cascade or a degenerative pathway. When you first go for an injury of a joint or a ligament or a tendon, they'll tell you just take an anti-inflammatory. And that anti-inflammatory essentially just makes the problem worse. It takes away the pain, but it stops the process of collagen regeneration and repair. And then once the joint space or the ligament or tendon complex is loose, it starts to get looser and looser as we use it. The loose joint creates more inflammation in the area of the joint capsule. And then what starts to happen is you get more inflammation, more pain. The next step is generally recommended is that you do a steroid injection. So steroids do pretty much the same thing as an NSAID or non-steroidal anti-inflammatory, but they do much more damage. So once you do injection of cortisone, it stops all inflammatory process, which gives you symptomatic relief, but it stops the repair process as well. You can only do a few cortisone shots before you actually destroy the collagen matrix and the whole thing becomes very lax, or it will essentially cause permanent damage to the ligament complex or the tendon complex. So the next step would be, well, we'll just do a little arthroscopic surgery. So let's say we have a knee with a meniscus tear. What's generally recommended is you go in and we'll quote clean it up. And cleaning it up means you go in and they bend the knee quite a bit, open up the space, put the instrument in that has a little device that kind of debrides the area, sucks out the debridement, and then they close it back up. Now that takes away anything that's potentially shearing off of the meniscus or any other area, but it makes that cartilage thinner and thinner, which is not what you want. So you've got three processes on the way to joint replacement that is all going into the degenerative cascade. So this doesn't make much sense unless you're in the business of joint replacement or arthroscopic surgery. We've been studying this for a while and we can see that this isn't the right way to go. It's not sustainable. So what we have decided to focus on is how do you renew or regenerate these areas that have come under just wear and tear through normal use. And as you get older, that just happens. Yet with the proper nutrition, the proper nutraceuticals, and the proper treatment, as well as the proper rehab, you can repair most conditions, even to the point of a bone-on-bone situation. When you have an injury to a tendon, ligament, or a joint, the best way to approach this is to put something in it that helps it regenerate so that the collagen matrix can rejoin and repair itself. So this is essentially what the aim of Maui Regenerative Medicine is, to give a viable alternative to surgical intervention. That's where we are, that's what we do, and that's what we love helping people with.